Charles Ornstein is arguably the toughest and most influential reporter in healthcare. He is an investigative reporter who has won the Pulitzer Prize for his healthcare industry exposés, and he is past president of the Association of Healthcare Journalists, an organization whose membership includes over 1,000 healthcare reporters. Many nurse leaders know Ornstein for his 2010 exposé on the California Board of Registered Nursing, which resulted in the firing of most of the board members, as well as the executive director's resignation. Due to Ornstein's previous adversarial reporting history with the nursing profession, most nurse leaders aren't particularly interested in speaking with the reporter. But one nurse leader was able to not only effectively deal with Ornstein on a controversial issue, but she was also able to turn him around to her point of view. Dr. Linda Schwartz, a Yale University nursing alumni, has dealt with the press for many years, not only in her current job as Assistant Secretary of Policy and Planning for the Veterans Administration, but in her previous position as Veterans Affairs Commissioner for the state of Connecticut.
Just because the press wants to talk to you doesn't mean that you have to talk to them. If they don't respect you, then you can say that. But I also believe that if you don't take the chance of expressing a professional or your opinion, you miss an opportunity to educate the public.
Ornstein had published a series of articles questioning the Veterans Administration's denial of health benefits for children of Vietnam vets exposed to Agent Orange, a toxic chemical believed to cause ill health effects not only for veterans themselves, but also their offspring. Schwartz was scheduled to attend a town meeting in which she had to face not only tough questions from Ornstein and other reporters, but angry veterans whose sick children had been denied health benefits.
I work now with public relations people that come with me, and they come because they think I might get into a little trouble. We had a town meeting that was sponsored by a newspaper and a very right-wing group. And it was supposed to be a very loaded experience, and VA sent, without me knowing, people in the audience to kind of, if it gets too heavy, they'll draw fire or something. Sometimes when you have people from the press, they are not well informed about what they're talking about. And you can't talk down to them. You have to say, just like you would to try to engage a patient in the process, you want to engage them in the process because they can send your message out.
Dr. Schwartz, do some vets that I've talked to and children of vets that I've talked to have said that they believe the VA does not want to know the answer to this question because they don't want to deal with the consequences of an answer and the compensation consequences of an answer. Can you sort of address that?
Point is, I have not heard one person at VA say that.
Say what?
That they don't want to know the answer to this question, that they don't want to do the research, because just being here and hearing again and knowing who we're talking about, I believe that these individuals deserve an answer. I believe that we need to at least ask the question, and I believe that VA is at that place where they are saying that as well. This is the right thing to do. And although we may not have all of the wonderful information, we have some. And so let us at least take a stab at this. And it is, as he pointed out, it is a complex issue. But I am a nurse by trade, so you can see that coming through. I think that they were like blown away. Really. It did take their thunder, but it was it took away a lot of the righteous indignation that they had been getting together to just send a zinger my way. But the most important thing, people in that room to me, were the veterans. and this is what I mean about just being the nurse. A veteran got up and talked about the death of his children, which he attributed to his exposure to Agent Orange. And he had big pictures of their tombstones.
As far as to care for him who has borne the battle, this hasn't worked for me. I fathered 5 children. The first one that was born died immediately after he was born, 9 months. Me and the wife had 2 miscarriages right after that. My 3rd child that was born has mental problems. My 4th child was born in the grave. So, to your question up there, is that toxic legacy hurting the children? Yes, it is, because that's my child. That's my child in the grave. The VA knew that they hurt us. They knew it back in early days, but you know what they did? They took over. They're saying that it took money, it was too much money to compensate us.
Dr. Schwartz, we have heard anecdotes like this where people have extraordinarily compelling stories about what has happened to their family, and it seems that perhaps those stories get lost.
Let me say, I can't imagine the pain that you are having.
I have every day, ma'am.
And your family. Let me say that this is a new day, and we are going, if we can move forward with this, if we can get this study, I know you've heard this before, and so have I. We will do this, not just for the ones who have passed away, but for the ones who are yet to be born. That's what we will do. Nobody knew what to say about that. But isn't that the way a nurse would respond? So you have to go back to your roots. What brought you to this? And remember why you became a nurse in the beginning. The press was really honed in on my response to that gentleman, the veteran with the pictures of the headstones. Nurses should take heart in the fact that the way in which we deal with humanity gives us an upper hand. Really. We have to remember why it is we got into this nursing and what it is. And so that is, in fact, a very empowering. I think nursing is such a dynamic and evolving entity, far more than probably anybody ever expected. We're going places that no one has ever really thought nurses would be. And so sometimes the simple way in which you have to look at it as an educational process. And I think that's oftentimes what helps me when I'm talking to them. They can use whatever I say to their advantage one way or the other. But if you miss the opportunity to be part of it, I would also say one thing is that if you have a good experience, or if a reporter really believes you, time and time again, even now that I'm here in Washington, they will call and say, we just heard this, what do you have to say about that? I can't go on the record now, but I can help them understand what's going on with this. And that is the role, that is a perfect role for nursing,